Hello, Mrs. Kacharian. My name is student Dr. Oganessian, and I will be doing your observation today, some history and physicals. So, what brings you in today?
So I'm starting to get pain right here on the side of my toe, and it's been hurting.
Okay. And what did you do? What were you doing when you first noticed this pain?
I was running on the treadmill, and I started feeling like pain. So I stopped, and it's been going on ever since.
And how long has it been going on?
About a week and a half.
About a week and a half.
Yeah.
And if, with one finger, can you point to where the
Right
pain
here,
is?
right on the side.
Okay, I see. Yeah. And well, how would you describe the pain? Is it like a throbbing pain? Is it a sharp pain? A dull pain?
It's more like a throbbing.
A throbbing pain.
Yeah.
Okay. And does anything make you feel better?
In
or
the shower,
worse?
sometimes when there's like hot water, I feel like it's better, but when I'm wearing tight shoes is when I feel the pain.
Yeah, of course. So anything like if it rubs against it, it's gonna be painful. Okay. And does the pain go anywhere else? Does it radiate anywhere? You know?
No,
just stays in.
just stays that same. Right
on that
here.
side of the toe. And the other side doesn't hurt.
No,
or just
no,
that one side.
just
Okay.
that side.
And as far as like the pain is pretty much just constant all the time.
Yes.
Okay, so all the time, just throbbing pain. Okay, and if you were to grade it on a scale of 1 to 10, 1 being no pain at all, and 10 being like the worst pain you ever felt, what would you say?
Like a 7.5, I would say.
7.5.
Yeah.
Okay. All right, sounds good. Now I'm gonna ask you to just take both your shoes off, if you will, and then I'll continue with some questioning.
Sure.
I'm just gonna ask you some questions about your, past medical history. Have you ever been hospitalized?
No.
Okay. Are you up to date on your immunizations?
Yes.
Okay. Have you ever had any serious illnesses?
No.
Okay. How are you on any medications?
No, just vitamins daily.
Okay. And
my allergy medicine here and there.
what kind of allergies do you have?
Seasonal. I
Okay.
like take a leg rest.
Apart from that, do you
No.
have anything?
No.
No allergies. Okay. And then have you ever had any blood transfusions done before?
No.
Okay. And patient is alert and oriented ×3. And okay. And then I'll ask you some questions about your social history. Okay. Do you smoke?
No.
Do you sleep normally?
Yeah.
You would say like 6 to 8 hours?
8 hours. I need my sleep.
Very good, very good. Are you married or single?
I am married.
You're married, okay. And do you you're sexually active?
Yes.
And you guys practice safe sex?
Safe sex. No.
You're monogamous. You don't
Yeah.
have
I only have.
Okay. Do you drink?
Occasionally.
Occasionally. What would you say? Like maybe weekends?
Once a month.
Once a month. Nothing crazy. Okay.
Mm-hmm.
When you drink, do you like drink a lot or?
No, just one drink.
Okay. Do you do any drugs?
No.
Okay. You said you were married. Do you travel?
Once in a while.
Okay. Anywhere out of the country?
Yeah.
What's your favorite place?
Monaco.
Monaco.
Yeah.
Okay. That's a very beautiful city. What do you do for work?
I'm a speech language pathologist.
Oh, very cool. Do you work with kids a lot?
Yes, I do.
Great. And do you exercise?
I do.
Okay, very good. Do you have any pets?
I don't. I want one though.
Okay. Well, okay. That's good. And I'll ask you a few questions about your family history. Do you do any of your family members have any illnesses or had any illnesses that you could think of? Anything serious?
No.
Diabetes, cancers,
No.
anything like that?
No.
Mom, dad,
No.
aunts, uncles, grandparents?
No.
No, nothing. Okay, great. Well, let's begin with our physical examination.
Sure.
And if I could have you just lay down.
Oh. Okay. Here?
Yeah,
Yes. Okay.
right there. I will start with your vascular test. Okay, so I'll just be checking for your pulses.
Mm-hmm.
So this is your dorsalis pedis pulse
Mm-hmm.
right here. Okay. And that's good, I can feel that. And then this is your posterior tibial pulse, right behind here. Good, you have a very good pulse there. And this is called your popliteal pulses. Okay. And those are great too. Okay, so pulses are all there. Now I'll test your skin turgor, which is great. The temperature feels normal and even
Do you want to
in
bring the
both
camera
legs.
closer?
And then I'll check your capillary refill. Okay, so I'm just squeezing on the toes here. Make sure the color returns, and it does, which is great. And then, yeah, and I'm assuming you shave your legs, but you have normal hair growth
Yes.
on your feet, on your toes. Okay, great. All right. Well, next we will do. Let me check your feet for any cuts, bruises, or abrasions. Your nails look fine, except of course for the little problem we have on that one. Okay. And check the back of your foot here. Everything looks good. I'll be sure to be careful with this nail. Okay, looks good. Again, I don't see any cuts, bruises. I don't feel anything except for some. There's some redness and some swelling and tenderness, right? When I
Oh yeah.
yeah,
Right there.
yeah, and then it feels a little warm.
Yes.
Okay. Okay, so that's good. Now I will do a few. Let's do the muscular testing.
Okay.
If you, the reflex testing. If you could please sit up
Sure.
for me, right here. Okay, great. So we're gonna check your knee reflexes, okay? Great, and this one. Great. And then we'll check your ankle reflexes also. Okay, and this one. Okay, great. Those are great. Okay, now I'm gonna have you ask you to push against my hands. All right, push to the sides for me. Great. Push in for me. Good. Push down for me. Good. And then up for me. Great. Okay, those are great. If I could have you lay down again, please. All right. Gonna do a few more tests here. Okay. Okay. So this is called the Babinski test. I'm just going to run this against your foot and see the reaction. Okay, good. Good. And then I'm going to do the vibratory test. Okay, I'm going to just hit this. It's going to vibrate, and you tell me when it stops vibrating. Okay. You feel that?
Stop.
Okay, good. Feel that?
Stop.
Okay, very good. Next, I'll do the Sam Weinstein microfilament or
Oh,
monofilament.
how scary. Okay.
No, this isn't scary at all. Give me your hand. It's just a little filament.
Okay.
Just tell me when you feel it, okay?
Alright. Feel it. Yes. Feel it. 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 Yes. Yes.
Okay.
Yes. Feel it. Feel it. Feel it. Feel it. Yeah. Yes. 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 Feel it.
Okay, great. So that's good. And then I'm gonna do the sharpness and dullness test on you. Okay, this is also not gonna hurt, so don't worry.
Okay.
I have two little instruments here. One is just gonna be, give me your hand. Just gonna be a little sharp.
Okay.
Once this is dull, okay, and you
Okay.
tell me what you feel.
Sharp.
Okay, but don't look.
Oh, okay. Dull.
Okay.
Sharp. Dull. Dull. Sharp.
Okay, great. Now we're gonna test your proprioception. Okay, I'm gonna touch your toe. Tell me which one I'm touching, and if I'm moving it up or down. Okay.
Mm-hmm. Down. Down.
Which toe is it?
It's the first one.
Okay, good. And then,
Third toe.
okay, and which way am I moving it?
Up.
Okay, good. And then let's do this one. Which toe?
Last,
Uh-huh.
down.
Okay, great. Alright, now I'm gonna check the tightness in your calves, okay?
Mm-hmm.
So,
Tendon.
silver sky test, okay, now bend your leg for me. Okay, looks good to me.
Mm-hmm.
And this one, put your foot in neutral position. Neck, and chin. Very good. Okay, if you could sit up for me.
Okay.
Alright, so from my observation, I noticed that your big toe is a little swollen, and on just one side, right? And it's swollen, it's red, it's warm to the touch. You said it's painful. So I see that the nail is kind of digging into the side, so I'm gonna say that it's an ingrown toenail.
Oh.
Okay, we call it onychocryptosis, but
Tongue twister.
yeah, for you that would just be an ingrown toenail.
Okay.
It does look infected because, like I said, it's red, it's warm. So my suggestion would be a nail avulsion. So I would take out the nail for you.
Okay.
And it's a pretty simple procedure. I would use a local anesthetic, numb up the toe,
Okay.
and we would just take out the nail. I'll give you some antibiotic ointment and some Tylenol for the pain.
Is it a painful procedure?
No, you should be fine. The needle is the most painful part. Other than that, you should be fine.
Okay, great.
Alright, well thank you so much. I really appreciate you coming in.
I
Of
really
course.
appreciate it. Thank you.
Of course.
And to make the appointment, I would talk to the
Yes,
ladies in the
just see
front.
the ladies in the front. Thank
All right,
you.
thank you so much.